Hi everyone and welcome this morning. I'm Jane, I'm one of your clinical supervisors, and today I'm going to be talking about a proposal to improve nursing job satisfaction and retention here at Atrium Health at Home. The topics we'll discuss today, we'll talk about the problem and describe what it is, which I'm sure most of you who have been in home care for a while are aware of the problem, the significance to nursing, the summary from a literature review that I conducted, my proposal to improve a job satisfaction and nursing retention, 2 recommendations to do that, and how they'll be implemented, and then we'll end with any questions that you may have. But please feel free to ask any questions throughout if you have any. So what we're going to talk about is the high turnover rate among home health nurses. In 2017, the turnover rate for home health nurses was 19.2% in the United States, compared to the overall turnover for all of the registered nurses, which was only 14.6%. And job satisfaction is the primary determinant of retention. Why is that significant to nursing? It is for several reasons. Transitioning to home care is a very difficult transition, even for experienced nurses. It's difficult to transfer from the acute care setting and the ambulatory setting to home health nursing. The primary area that is the most challenging is case management. Most nurses, when they come into home care, they know how to do wound care. They know how to do patient education and those tangible type skills, but they're not as familiar with case management skills. And as you know, most of our leaders here at Atrium Health at Home will tell new nurses it can take up to a year to feel comfortable in their new role and to develop those skills, especially of case management. Case management really involves overall coordination of care, and it's more of a comprehensive approach to caring for a patient and delivery of nursing care. Nurses often report that they feel a lack of support and feel overwhelmed when they transition to home care. They also report difficulty maintaining a healthy work-life balance. And all of this leads to higher job satisfaction and higher turnover. I did spend a significant amount of time looking at the literature and doing research on this subject, and found that there are some strategies that can improve job satisfaction among home health nurses and retention. Using targeted screening and interview items will help determine what nurses will be successful in home health care and what nurses will likely stay long term. Also, mentoring programs have been shown to increase the competence and the confidence of new nurses. This also helps to improve the retention. Mentoring during the first year of a new nurse's home health career beyond their orientation can lead to more engaged and more satisfied nurses and can decrease turnover. We have a very robust and comprehensive orientation program here at Atrium Health at Home. It lasts for a full 12 weeks, which is good, but it's that in-between time, when nurses start out on their own, that is really probably the most difficult and challenging for them, where they feel lack of support. And finally, what I learned from the research is that case management interventions can be very beneficial for decreasing ED use, decreasing rehospitalizations, and healthcare costs. So my proposal for Atrium Health at Home would be to use targeted interview items and a mentoring program to improve job satisfaction and retention among our new nurses. My first recommendation would be to use and identify 10 interview items to use for screening and interviewing new nursing candidates. We would use these interview items to review the candidates' applications when they're submitted. We'd also use the interview items to determine who would be the most qualified candidates when we're interviewing them. And another benefit of using these interview items would be the candidates will gain a better understanding of home health care, and it will help them to decide if that would be the best fit for them. My second recommendation would be to start a formal mentoring program for the first year for the new nurses. So that would be after orientation up until they've been with Atrium Health at Home for a year. Experienced and engaged nurses would be paired with new nurses. And an educational packet would be created to focus on probably the areas that are the most difficult when nurses transition to home care, which are case management, critical thinking, and time management. The mentors would meet with the new nurses every 2 weeks, and they would be available for guidance and support in between those meetings, by phone or by email. So to implement these two recommendations, for the 10 interview items, I would recommend that the nurse manager, case managers, and our lead nurse will create these 10 interview items. And the areas that I think would be important to focus on for these items would be skills competence, case management, critical thinking, patient education, cultural competence, organizational skills, documentation requirements, communication skills, regulatory requirements, and technology competence. And as you can see, that's pretty broad and a pretty comprehensive list, but it really is all that is entailed with home health care nursing. The nurse manager would use these items to screen candidates when they apply for our nursing position, to decide who we will interview. And then our interview panel will use these items to interview the candidate and determine who would be the most qualified. Then for the mentoring program, our nurse educator, nurse manager, clinical supervisors, and our lead nurse will create an education packet. The nurse manager will identify experienced and engaged nurses that have been with our agency for a while to be mentors. And the nurse educator will conduct an orientation class for these mentors, which will last about an hour. New nurses will start the mentoring program after their 12-week orientation. And the mentors and the new nurses will meet every 2 weeks. And that'll just give the nurses an opportunity to talk about any questions they have or concerns or any clinical situations that they weren't comfortable in or really need help and guidance for that. And the mentors will be available to the new nurses by phone or by email in between these meetings. Again, to help with guidance or anything that comes up that's more urgent, but also just to provide additional emotional support, as it can be really difficult in this new role, and also we don't want the nurses to feel like they're kind of out there on their own and don't have enough support. So in conclusion, as most of you know, home care has changed a lot, and there's shorter hospital inpatient stays. Patients are being discharged with an increased acuity level, and there's an increased need for home health services. Especially in the year 2020, we're seeing with this COVID-19 pandemic that people who don't have COVID-19 are trying to discharge them sooner, so they're not at higher risk of getting it. And so that there's enough room in the hospitals for COVID-19 patients. And we're also getting COVID-19 patients more and more that are coming home that are debilitated and need more education on how to manage their disease process. It's really imperative that home health agencies address the high nursing turnover and improve job satisfaction and retention among new nurses that come into home health care. And I do think that selecting candidates who would be successful in home care would be a good strategy to use by using these interview items, and also providing a mentoring program for additional education and support so that we do increase job satisfaction and retention among our nurses. Does anyone have any questions? All right, well, thank you for your time.